So I'm a clinical social worker here at the MDI hospital. I work with Dr. Abreu, and on my caseload of clients, I meet with them individually. It ranges from ages currently 6 to 79, so a wide range. And I chose to talk about foster care today because oftentimes in our sessions, probably a third of my clients are somehow involved in foster care. On a personal basis, I volunteer with many foster care agencies. I am a foster parent. I'm an adoptive parent. I'm a biological parent. So I just thought I'd use my 10 minutes. I know that we're all aware of foster care, but I wanted to spend some time talking about resources and information that may be useful when you're meeting with your patients. And I also wanted to share some information on foster care specific to the state of Maine. You can stay right on this slide. So Maine has one of the highest rates of opiate-affected babies in the country, and the surge in pregnant women who are opiate addicted have challenged Maine hospitals, treatment centers, and foster care systems. An average of 975 drug-affected babies were born each year in the state of Maine, which is an average of 3 babies a day. Next slide, please. So although most statistics don't differentiate between what substances the mother was using, the escalation of drug-affected babies parallels Maine's rise in the opiate addiction. The vice president of Maine Medical Association shared that when you have 950 plus babies out of 13,000 births, that's about 7% of our births are from mothers with a substance abuse disorder. On a national level, pregnant women with an opioid use disorder quadrupled over the last 15 years, according to the CDC. And during this time, Maine had the second highest annual average of 4 babies per 1,000. So as you know, when these children go into foster care, if foster care can be found, it's not an easy journey for the children, foster parents, or the biological parents. And I think that what we need to consider as professionals is what these developmental, behavioral, and emotional problems, like what these children are facing, and also the school systems and, you know, our profession as a whole. Next slide. 30% of children in foster care are being raised by relatives. This represents a 6% increase from 24% of children in foster care from 2008. And there's a huge increase in the number of grandparents raising their grandchildren. That's directly tied to the opiate crisis. In Maine, it increased 24% in the last 5 years. Next slide. So the executive director of Adoptive and Foster Families of Maine shared that due to a state law that now requires infants to be tested for drugs at birth if their mother is suspected of using drugs during pregnancy, is leading to far more infants entering the foster care system. And Penobscot County has the state's highest rate of opiate-affected babies. Between 2014 to 16, there were 600 plus drug-affected babies born, which doubled any county in Maine. Next slide. According to DHHS, 2/3 of drug-affected babies were born to mothers with a high school education or less. And also, according to the department, 69% of the 250 women who gave birth to a drug-affected baby between 2014-16 also gave birth to another infant who suffered withdrawal symptoms during the same period. Next slide. There were 1,493 licensed foster homes in Maine as of July 2018. This is a reduction in foster care homes by 200 in the last 2 years. I work as a resource mentor, and so working with a new family just this past summer in Hancock County, to give you an idea of the need, within a 2-week period of time, this brand new, this family that's brand new to foster care received calls for a 17-month-old, 3- and 5-year-old, 9-year-old, 6-year-old, 9-month-old, and 9- and 2-year-old siblings within a 14-day period of time. And so also consider that that's in the summer where children aren't being seen in schools. So kind of off the radar. Next slide, please. So these are some of the programs I wanted to share with you, and the services are all free. ECHO is a grant-funded program through Healthy Acadia, Early Childhood Consultation and Outreach. This is an early childhood intervention led by a social worker, and she'll work with educators and families to identify social, emotional, or behavioral issues from children birth 0 to 8. The referral process is a single sheet. It can be filled out by parents, preschool teachers, grade school teachers, physicians. It's a very simple referral process. Again, and the service is free. So this person might come to a daycare and do an observation, or the social worker may work with the grade school teacher. Similar programs in Washington County are through Community Care Collaborative. And so the state of Maine has received money to pilot 5 programs, and currently they're just watching the 2 existing programs, monitoring for their success. Next slide, please. Adoptive and Foster Families of Maine, as I mentioned, has a mentor service. And so this is to help new foster or resource families get accustomed to their role. They are paired with a more experienced foster parent. They can call this person at any time. They can schedule a visit, but it starts as soon as they become foster parents. So they may call the resource mentor and say, how come I haven't received any calls? Or then once a placement takes place and they have struggles, or if they can't reach their caseworker, then this is a person that's generally available. Next slide. Resource Parent Care Team. This is through CHCS, a service that's partnering with DHHS, and that they support, again, the foster parents. Foster parents are the client. And so CHCS has a part-time person who actually sits in the DHHS office to field calls, and then there's a full-time person. And they will go into the home. They will assess what's going on, if there's a behavior or situation in which the parent is struggling. A free service again, and it's quite timely. Like they get out there within a week or so. Next slide. The Maine Parent Federation, funded by the U.S. Department of Ed, Office of Special Ed and Rehab Services. The staff are parents who have children with disabilities, and they have access to a wide range of information. Again, this is a free and a very timely service. I'm a family support navigator. This person can go with parents if they're preparing and they need to attend a PET. Again, it's a free service, and it's available for one-on-one, and the family support person would come to their house. Next slide. This is a film that's used to educate new foster and resource parents, generally during trainings. It's a 13-minute film. It's definitely worth watching. It's a journey of a 9-year-old who was taken from her parents and placed in foster care. And one description of the film begins by reminding us, it is natural for you to think about how fostering will affect your life, but try and imagine what it's like for that child in care. It's a unique perspective. Oftentimes we often focus on the abuse experienced by the child in the birth home, but there are countless stories of the abuse experienced as the child bounces sometimes from foster parent to foster parent. And the list I gave you from the foster parents that were here in Bar Harbor, 2 or 3 of those children were being bounced from different foster families. So this film really depicts what a child would be going through. And that is the end of my presentation.